Do you know what a stroke is? It's a medical emergency that requires immediate attention. Picture your brain, that wonderful, complex organ that controls all your body's functions. Now imagine if the blood supply to your brain suddenly gets disrupted. This is what happens during a stroke. There are two main types of strokes, ischemic and hemorrhagic. An ischemic stroke is when there's a blockage in the blood vessels that supply blood to the brain. Think of it like a traffic jam in your brain's highways. On the other hand, a hemorrhagic stroke is when a blood vessel in your brain bursts or leaks. It's like a flood in your brain streets. Both types are equally serious and can lead to severe health complications, even death. Now that we understand what a stroke is, let's learn how to recognize it. To recognize a stroke, we use a system called the FAST criteria. This acronym is a guide to help identify the most common symptoms of a stroke. F stands for face drooping. This typically means one side of the face is drooping or numb, often noticeable with a lopsided smile. A is for arm weakness. If a person can't raise both arms and keep them there because one arm drifts downward, it's a warning sign. S is for speech difficulty. Listen for slurred speech or trouble speaking. The last letter T stands for time to call 911. If you observe any of these signs, even if they disappear, call for medical help immediately. The sooner a stroke is treated, the better the outcome can be. So remember, when it comes to a stroke, think and act fast. Now let's break down each component of FAST. Recognizing the signs of a stroke is crucial for prompt intervention. Let's get a closer look at each component of the FAST criteria to help us do just that. Starting with F, we have face drooping. If you suspect someone is having a stroke, ask them to smile. If one side of their face droops or doesn't move as much as the other, this could be a sign of a stroke. It's like the face is saying, "Hey, I'm not feeling quite right here." Next, we move to A, representing arm weakness. Ask the person to raise both arms. If they have trouble raising one arm or one arm drifts downward, it's another red flag. Their arm is essentially signaling, "I need help, I can't hold up like I used to." Then we have S for speech difficulty. Ask the person to repeat a simple sentence. If their speech sounds slurred or they can't repeat the sentence correctly, it might be a sign of a stroke. It's as if the words are stuck in their mouth, trying to get out, but just can't make it. Now, these signs might not always be very prominent. They could be subtle. So, it's important to pay close attention and trust your instincts. If something doesn't seem right, it's better to err on the side of caution. Remember, strokes are a medical emergency. Every second counts. If you see any of these signs, don't hesitate or ignore them. The T in FAST reminds us of that. It stands for time to call an emergency service. Don't wait for the signs to get worse. Your prompt action could make a significant difference in someone's recovery and may even save their life. It's like being a superhero, saving lives with the power of knowledge. And who knows, the life you save could be someone you care about. So let's keep our eyes open and be ready to act fast. If you notice any of these signs, it's time to act immediately. Time is of the essence when it comes to a stroke. If you observe any signs of a stroke, face drooping, arm weakness, or speech difficulties, it's crucial to act swiftly. The T in our FAST acronym stands for time, and every second counts. Dialing 911 immediately is imperative. The sooner medical help can be provided, the better the chances of minimizing damage and enhancing recovery. While waiting for professional medical assistance, it's important to keep the person calm. Reassure them that help is on the way. Ensure they are in a comfortable position, but avoid giving them any food or drink, as this could potentially lead to choking. In conclusion, strokes are medical emergencies that require instant action. By recognizing the signs using the FAST criteria, you could potentially save a life. Remember, recognizing a stroke using the FAST criteria can save lives. To sum up, recognizing a stroke is a crucial skill that everyone should have. It's as simple as remembering the FAST criteria: face drooping, arm weakness, speech difficulty, and time is of the essence. Stay safe, everyone, and remember, time is critical when it comes to a stroke. Stay tuned for more informative videos on health and safety.